The COMA trial. Welcome to the Everything Surgery podcast, where we delve into the latest in surgical research and practice. In this episode, we are exploring a landmark study published in The Lancet in March 2017, the conservative versus open management of acute uncomplicated appendicitis trial, also known as the COMA trial. Let us begin with an overview. The COMA trial was a pilot study conducted in the United Kingdom, designed to assess whether treating adults with acute uncomplicated appendicitis using only antibiotics, without surgery, could be a safe and practical alternative to the traditional approach of surgical removal of the appendix, or appendectomy. The primary aim of this trial was not to determine which treatment was superior, but rather to establish whether conducting a larger, more definitive trial within the National Health Service would be feasible. Here are the key details. This was a multicenter, randomized, controlled feasibility trial that recruited 100 adult participants, all over the age of 16 and diagnosed with uncomplicated appendicitis. These patients had no signs of perforation, abscess, or peritonitis as confirmed by computed tomography scans. The participants were divided into two groups. The conservative group, which consisted of 47 individuals, received an initial course of intravenous antibiotics followed by oral antibiotics. The appendectomy group, with 53 participants, underwent surgical removal of the appendix, either by laparoscopic or open technique. Now, let us discuss the key findings. First, the trial demonstrated that recruiting participants was entirely achievable and that patients were more willing than expected to be randomly assigned to either surgical or antibiotic treatment. In terms of treatment outcomes, 74% of patients in the antibiotic group were successfully treated without requiring an operation within the first 3 months of follow-up. This means that approximately 1 in 4 eventually needed surgery, mostly because their symptoms recurred. In the appendectomy group, nearly every patient was successfully treated by surgery, as anticipated. When it comes to complications, both groups experienced low rates overall. Importantly, there was no significant difference in the rate of serious adverse events between the two approaches. Patient-reported outcomes revealed that those managed with antibiotics alone returned to their normal activities more quickly and enjoyed better quality of life scores during the first 2 weeks after treatment. In contrast, those who underwent surgery had a longer initial stay in hospital. In conclusion, the COMA trial found that non-operative management is a viable and safe option for most carefully selected adults with uncomplicated appendicitis. Approximately 3 out of 4 patients can avoid surgery in the short term with antibiotics alone, but there is a trade-off. About 1 in 4 will experience a recurrence of appendicitis within the first few months, a risk that should be discussed with every patient. The successful completion of this trial paved the way for a larger, definitive study, the contract trial, which would further investigate long-term outcomes, cost-effectiveness, and patient satisfaction. To summarize, the conservative approach using antibiotics helps patients avoid the risks associated with surgery, such as anesthesia and scarring, and allows for a quicker return to normal activities. However, there remains a significant chance that the appendicitis will return. On the other hand, appendectomy provides an immediate and definitive cure but comes with its own risks and a longer initial recovery period. The COMA trial was an important milestone in changing how we think about the management of appendicitis, establishing antibiotics as a legitimate first-line option for informed patients who wish to avoid an operation. Thank you for joining us. If you value our insights, please like, share, and subscribe to the Everything Surgery podcast, where we continue to dissect the extraordinary world of surgery.